We've talked a lot about Medicare, and now we really want to talk to you about Medicare Supplement insurance policies. I like to think of these as the pay me now, pay me later approach to Medicare. So when you're looking at Medicare and you're on Original Medicare, you need to make a decision. Are you wanting to pay in advance for when life happens, or would you rather pay as you go with your Medicare Advantage? A lot of people have planned for their retirement and they would rather just know that things are paid for so that when they need it, it's already available. This is where supplements come into play. A Medicare supplement is going to partner with Original Medicare and a prescription drug plan. As you choose to go onto a Part D plan, you'll want to pick up this Medicare supplement or Medigap plan to make sure that those gaps in coverage in Original Medicare are taken care of. These plans help to cover the out-of-pocket expenses that you're going to encounter along the way. For example, when you're on your Part A, if you were to be hospitalized, you're going to have that deductible and some co-insurance payments if you're in the hospital for longer than 60 days. In this case, depending on the Medicare supplement that you pick, that may cover those so that you don't have to worry about where that money is going to come from. For Part B, you know that you have a deductible annually, and then you have an 80% coverage from the government, but 20% of costs are at your expense with no cap in that coverage. Medicare supplements can close the gap on that too. Now in 47 states, these plans are all standardized to the same plans. More of the alphabet, where you have plans A, B, F, G, L, and K, and many more. One of the things that people get confused about is that Plan F was grandfathered and is no longer available if you turn 65 after January 1st of 2020. Under these Medicare supplements, what I want you to walk away from, if you learn nothing else, is that they are fully regulated by the federal government, even though they are offered by private insurance companies. So if you go to buy a Medicare supplement plan, think of it as like buying gasoline. Whether you go to the 7-Eleven or the Shell Oil, when you pull up, you're going to need to put that 89 octane in your car, and it's the same exact gasoline no matter where you go. The cost difference is going to be the overhead cost, the cost of your insurance company or that gas station to actually do business. In the Medicare world, what that means is the supplements have payment to claim ratios, or how often they're having to pay out for expenses for the healthcare needs of the people that they're servicing. So whether you buy a Plan G at Company A or Company B, it's the exact same coverage. If anyone ever tells you that their plan is better than the other, they're probably not explaining things quite as succinctly as they should be to you. For a Medicare supplement, when you really dive in, these plans available in 47 states, there are going to be 10 options to you. These plans cover a wide variety of things, from co-insurance of Plan A to your coverage insurance for Part B, and some will cover pints of blood and hospital expenses. Additional benefits acquired through some of these plans are emergency foreign travel health insurance coverage, coverage for your Part B excess fees, and other things. Now, what's an excess fee? With doctors, they decide whether or not they want to cover Medicare. If a doctor decides that they are going to accept Medicare as an insurance, they now have to decide whether or not they accept assignment. What this means is the doctor is saying that the Medicare schedule of fees is acceptable to them, and they're going to allow that to be the schedule that they bill to a client. Some doctors do not accept this fee. Many of your specialists or the major health clinics, such as the Mayo Clinic, MD Anderson, or Johns Hopkins, often do not accept assignment. That means that they can bill you up to 15% over that Medicare schedule. When this happens, if your plan doesn't cover excess charges, you'll be on the hook for additional expenses. For a Medicare supplement, when you select this policy at the time that you first join Medicare, you will get this without any underwriting requirements. This is known as the initial enrollment period. Oftentimes, clients' initial enrollment period is when they're turning 65, and it's a 7-month window that lasts from 3 months prior to your 65th birthday through 3 months following your birthday month. It's a 7-month window that covers 3 months prior to your birthday to 3 months following your birthday month. For the initial election period, if you decide that you have creditable coverage through your employer, and so you're going to defer your Medicare Part B, you will get your initial enrollment period when you finally pick up your Part B later. Additionally, there are special election periods, such as when you move from a state that has a certain plan to a state that does not have your plan, or if you have a special election because, let's say you live in Wisconsin, Massachusetts, or Minnesota and move to a state where the plans are standardized, you may be able to pick up a Medicare supplement at that time without underwriting. If you don't have any kind of a qualifying reason, you will have to go through what's known as simplified underwriting to join a Medicare plan later for a supplement. Simplified underwriting often is a list of underwriting questions asking you basic medical information, and then they're going to pull your prescription drug history. At that time, the underwriters are going to make a decision on whether or not they can offer the plan to you. A final time that you can join Medicare supplements without any kind of underwriting is if you choose to go onto a Medicare Advantage plan. When you first pick up Medicare Advantage, you get what's known as a trial right or get out of jail free card. For 12 months, you're allowed to make the decision that you want to go back to original Medicare and pick up a supplement. If you were on a supplement previously, you have to go back to the same carrier and plan you had before. If you join Medicare for the first time and go to Medicare Advantage, then when you go back to original Medicare, you're simply just going to pick up the supplement available to you based on your age as a guarantee issue option. For many, that's going to be Plan G, and for some, it may be Plan F if you turn 65 prior to January 1st of 2020. Either way, we know there's a lot to cover and a lot of different options, so we want to make sure that Medicare supplements are something that's easy for you to figure out. At Magellan Healthcare, we can help you through all of these decisions. Once you're on the supplement plan, it typically will not be reviewed for every few years unless you find that you have some rate concerns. Otherwise, you'll just know that during the annual election period every year, from October 15th to December 7th, you need to evaluate your prescription drug plan that's going to partner with it to make sure that your maintenance drugs and pharmacies that you prefer to have are all covered appropriately. If you have questions, reach out to us at Magellan Healthcare so we can help you with these enrollment needs.